Look, I think Senator Colbeck, the minister, just has to get out and talk to some more aged care workers. He clearly doesn't understand the industry. We spoke to over 1,000 aged care workers and, many of them were saying they hadn't been prepared. 3 out of 10 said they hadn't done any specific training for COVID-19. And certainly the issue of PPE was raised again and again and again.
So we know the aged care system is in crisis even prior to COVID-19. We had a Royal Commission. We're still hearing horrifying stories. What needs to be done?
Well, look, as you said, this is no surprise. It's sad, it's horrifying, but this is no shock. Around the world, aged care has been a flashpoint. The government knew this was coming. We have the most vulnerable cohort of people in Australia to COVID-19 and a system that is already under stress. We have a Royal Commission. We knew there was problems in the system and the government really should have acted earlier. We should have had more training. We should have had more staff in the facilities before the outbreaks, not waiting for an outbreak and then thinking, oh, we better put some people in there.
Yes, because this week, Carolyn, I read that 1 in 5 aged care workers in the Australian newspaper had done the federal government's personal protection training module on the eve of the Victorian COVID spike. So, so only 1 in 5 there.
Yeah, and look, many aged care workers do that sort of infection control training as a normal part of their job, but it is pretty worrying that the government's own program, I've heard many criticisms of that program, that it wasn't good enough and that people weren't using that program.
The government in March has $101.2 million to limit the spread of the virus in the aged care facilities, $44,000 spent on developing a free online program that included educating workers in infection control. What are they actually learning online and how long does it take?
Look, it's short, it's pretty poor, really, when you look at what you're trying to do here. I understand you might have a short online course for hospitality workers, but this is aged care workers. They're not just wiping down a bench, they are looking after older Australians who deserve respect, dignity and safety.
They certainly are, Carolyn, and there are really so many reasons nursing homes are so vulnerable, aren't there?
Yeah, look, as I said, it's really the flashpoint. We have the most vulnerable cohort. When we look overseas, in many countries, the majority of their deaths were in residential aged care, so we know that they are incredibly vulnerable. They're a vulnerable cohort. Residential aged care brings together large numbers of people. They're moving around, they're having dinner together in the dining room, they're doing activities, so there's a lot of opportunity for cross-infection. And as I said before, it's a system already that there's not enough staff in. There's not enough staff. They were struggling prior to COVID, and what they said in the survey to us is the workload just increased.
Well, the ratio to carers and staff, I was reading this week, one area had a 1 to 13 ratio. Is there a specific number that's required?
There is no minimum mandated staffing level for aged care. So there's a very vague quality standard about providing sufficient care. There is nothing, there's no actual level that providers have to fulfil, and there's no level that the government has to fund to. So I think, we really have to also look at the federal government as funder and as responsible for the system, because I think they've failed as funder and they've failed in their response to the COVID-19 crisis in residential care.
Carolyn, what would happen if they do a work stoppage because perhaps of safety reasons? How would you manage that?
Look, I think there's been, questions about that. Will people stay? And I think it's just an incredible testament to aged care workers that they are in some of the most dangerous workplaces in Australia at the moment. And every worker does have the right to stop work if they feel unsafe, but we actually haven't seen the sort of stop work that we might have seen. And I think that is a testament to the fact that they are so passionate about their jobs. many people in aged care, up to 50%, have no family visiting them when they're in aged care. Carers become their family. They care deeply. They see people every day. I think it's an incredible testament to their commitment and their passion and their care for older Australians that we haven't seen massive stop works across the sector.
Yeah, very selfless people indeed. Carolyn, what happens perhaps when they go home? There's certain protocols. Do they get out of their uniform? But not only what are the concerns when they go home, no doubt the carers would be concerned going into the aged care residency.
Yeah, look, there's been a huge focus on the residents in aged care, as there should be. But this time has had a huge emotional toll on workers. I've spoken to workers and they talk about worrying first about taking the virus in. So they're quite aware that they could be carriers, they could be asymptomatic carriers. So they worry terribly about the kind of frail people that they look after. And then they worry about taking the virus back out to their families. And it's been a really hard time. The workload has increased, the physical workload has increased, the emotional workload has increased. Carers were reporting a lot more, their residents being a lot more stressed, a lot more anxious. Often with people with dementia, that means a lot more difficult behaviours. So as I said, the work has got harder, and then that secondary emotional toll about, am I a carrier or am I taking this virus back home from my workplace, which, by the way, I don't get paid much, don't get enough hours, but I'm doing this work and I'm potentially taking the virus back home to my family.
Yeah, it's so frightening, isn't it? And as you mentioned, not only on an emotional scale, but a physical and potentially affecting others. Now, we did speak about this during the week, and I want to end on a positive note. What is it that you love about the people who work in aged care?
Well, look, as a union leader, I get to spend a lot of time with aged care workers, and I love to be in a room of aged care workers. They are funny, they are smart, they are passionate about what they do. And most of all, I mean, they want to see change in this sector. They want to see decent workloads so they can provide quality care. And they talk about the residents that they care for, and it's just, they're wonderful people to be with.